about, good questions to ask providers and how different types of treatments that were available, and making sure individuals were aware what is out there, and I'm encouraging you to seek out the different kinds of treatments so you can find what's best for you, because Dr. Ritchie, you would say, does every treatment work for every person?
Of course, not every treatment works for every person. But what we do is we have a stepped approach to PTSD treatment. And by that I mean you try one thing first, often either psychotherapy or a medication. And if that alone doesn't take care of the symptoms, we add another treatment, maybe another medication or a combination of psychotherapy, and by that I mean talk therapy, and a medication. And if that doesn't work, maybe we'll switch medications. The good thing, Nicole, is that there's treatment guidelines out there on PTSD. So the American Psychiatric Association has treatment guidelines, and there's DoD VA treatment guidelines. And a practitioner can easily Google VA, DoD treatment guidelines for PTSD, and they're right there. So the provider has no excuse to not be familiar with how to treat PTSD. Now, if they haven't done it before, they may want to consult or have some on-the-job training. But we do know how to treat PTSD. The provider has to go and look and find the training, and the patient has to be willing to say, hey, I want evidence-based treatment.
Now, outside of this, you talked about animals. We've got the Wounded Warrior Equine Program, and there's so many other different organizations out there that are providing these type of trainings. What about PTSD service dogs?
Well, as you say, Nicole, there are a lot of different groups who are looking at animals in a variety of different ways. And the problem is, although we all feel very good about it, we don't yet have the hard science, although we're beginning to develop some of it. There's some research going on the National Intrepid Center of Excellence. Before I answer your question specifically about PTSD service dogs, I want to just outline a few of the different ways that animals are used. One is a conventional service animal, such as you have for blindness or deafness or problems with mobility. And there's beginning to be service animals for people with PTSD, but there's still some controversy about that. And then there are also therapy animals, and we have animal-assisted therapy dogs, which we actually brought to Iraq and Afghanistan to help the counselors over there. And the animal-assisted therapy dogs essentially act as a bridge. Soldiers who don't want to come in and talk to a therapist will come in and pat the dog. And then you have service members with PTSD themselves who are helping train animals to become service dogs for other wounded vets. And we find that the act of training the dog actually helps reduce PTSD symptoms. Again, that's research in progress right now. We can't definitively prescribe this treatment with evidence behind it. But I'm really excited. And then you mentioned horses, equines. There's a lot of interesting work also working with horses, not so much about learning to ride a horse. You do have some of that for people with spinal cord injuries, but learning how to breathe with a horse, how to quiet a horse, how to groom a horse. And people find that doing that also helps their own symptoms of PTSD.
Now, I can actually attest to that from personal experience that I have my own horse, and he's helped me quite considerably also with therapy for my back. So there's a lot of wonderful programs out there as far as those are concerned, and I encourage all of you listening to definitely look into those programs. What if an individual is, this may be a different area, sorry, I just had to swallow. PTSD dogs, do you know about any good organizations that you would support, or actually just say are decent organizations for individuals to look into for getting their own dog?
Yes, and let me say that the organizations I'm most familiar with are ones that have been providing service dogs for a long time, and they're beginning to look at providing dogs for either people with post-traumatic stress disorder or children with autism or people who have other emotional issues. The ones I'm most familiar with is an organization called NEADS, which used to stand for New England Assistance Disability Dogs. Now it's just called NEADS. It's up in the New England area. Google NEADS. Then there's Vet Dogs in Long Island, which has been providing dogs for veterans. And then there's Canines for Companion Independence, CCI, which has offices in 5 different places. And those are all reputable organizations. There's a lot of other organizations who are providing animals. I've heard a few scandals, and so I advise people to be careful. So I would go to one of those organizations for a start if you're interested in a service dog. Now, what's really important is that if you're going to get a service dog for post-traumatic stress disorder and anything else, you have to be in a position to take care of the dog. It's not a light thing. If you are going to go into the hospital and be having surgeries, you've got to think about who's going to take care of your dog while you're in the hospital. If you're on active duty, you probably shouldn't get a service dog at all, because if you're getting a service dog for a disability, you're probably transitioning to the VA. You certainly shouldn't get a dog if you're going to deploy, because again, who's going to take care of your animal? And one of the things about service animals is these organizations try very hard to bond you and the dog. So it's not like you should go and just leave the dog with your mom or your aunt. Service dogs are really for the specific person with the disability. It's a little bit different with some of the other work that we do with therapy dogs, where the dog belongs to the combat stress control unit or belongs to the facility and has a handler or an owner, and you just come and bond with the dog, but the dog isn't actually your dog. You may want to consider some of that, just working with some of the therapy dogs, but not getting a dog of your own unless you're absolutely sure that you can take care of that animal for not just the next 1 year, but the next 10 or 15 years.
And be there with your dog.
With your dog.
I'm going to tell you, folks, if you have any questions, please go ahead and send them in. I'll send them to Dr. Ritchie. She's a very busy woman, but if she gets time, I'm sure she'll let me know what she can answer. But I thank you so much, Dr. Ritchie, for being here today and for being willing to do this. This is Nicole Johnson-Starr with the PTSD Retreat Radio Talk Show. Have a great evening.